Hello, I'm Tiffany Cook, the Population Health Manager here at McGowan Brabender. The Population Health team is here to help our clients figure out where they want to go for their health management and wellness initiatives. At any point, if you have a client that is interested or thinks that they would like to learn more about wellness and health management, our team is here to support you. We help our clients with all different types of strategies. Some clients are at the very beginning of stages of learning about wellness and health management programs, and then some of our clients have a fully outcomes-based program. And then there's all of the ones in the middle as well. So we are here to do a discovery call with the client and help them understand the different steps for the journey. We will lead that discussion and be able to take that off the account teams and consultants' plates. If you have a client that already has something in place but would really like to fine-tune it or maybe find a different vendor to implement, we are here to make those recommendations and suggestions and lead the client through that entire process. The population health team's goal is to really mitigate the risk within our clients' employees and spouses. We are here to build that strategy to break down those barriers with the risk mitigation. Sometimes that will include in-house programs to address that, and then sometimes that will include having different vendors be able to be a part of that program. The term wellness versus health management is two different things. Think of the term wellness as those running a 5K or nutrition and fitness challenges. It is a lot of the fluffy, enjoyable, fun types of things. But there's no scientific research that shows that doing the wellness side of the program is going to help reduce those cost claims. So what we really like to turn to is the conversation around health management. Health management are understanding those risk values from a biometric screening, a relationship with the primary care physician, age, gender, cancer screenings, health coaching, and disease management. When you have both of those married together within a program, that is setting the program up for the best success, because everybody likes to have those fun elements to a wellness program, but also we need the important pieces to be able to drive down those claims. It's really important to also understand what is a biometric screening. So a biometric screening is a finger prick or a venipuncture blood draw where employees are able to easily identify their risk value numbers. Within a biometric screening, the things that are tested for the risk values are blood pressure, glucose, triglycerides, cholesterol, and waist circumference. Those 5 risk factors make up what we call metabolic syndrome, or MET-S for short. That will be important as we turn and talk about outcomes-based programs. Once you find out your metrics, then you're able to take a deeper dive into addressing the risk. This is usually the very first step of a wellness initiative or wellness or health management initiative within the company's programs. The second piece is that approach to a primary care physician. Having that relationship with a PCP is so important for future risk and future chronic conditions that may appear, and also the driving factor of different screenings that need to happen. So that primary care physician has a different level of working with their patient on different metrics and meeting different goals than an employer can have. We do like to drive home that conversation around a primary care physician, and this is usually step number 2 that we talk about within the steps for the journey. Think about population health as an umbrella. There are different spokes that poke down from that umbrella. The different spokes are the different key metrics that our team works with our clients on. And those metrics or different activities within the health management program are a primary care physician campaign, health coaching, lunch and learn education sessions, telemedicine, tobacco surcharge and cessation programs, wellness portals, health coaching, on-site biometric screenings, challenges and activities, disease management, and EAP and mental health. So all of those spokes are what our team can wrap our hands around and be able to drive those conversations with the clients. There are a few different types of wellness programs that I like to point out. There are a participatory program, an activity or participation-based program, and an outcomes-based program. With a participatory program, it is just where employers are providing challenges or providing biometrics, but there is no incentive around and tied to that. We usually see pretty low engagement with this piece. The incentive is really a driving factor in order to gear up engagement inside of a program. That activity or participation-based program is where there are all different kinds of objectives. So maybe go to your primary care physician and have your annual physical, or complete the biometric screening, or complete 2 challenges, and then you do earn a reward. But there are no outcomes that are tied to that. That's where the third type of program comes into play, the outcomes-based program. That is when there are requirements for an employee to complete a biometric screening, learning about their different risk factors, and understanding if they're falling within that bucket of metabolic syndrome, or MET-S. And if they are, they have additional requirements they must meet in order to earn that incentive or avoid the surcharge. When we are working with the different clients, we drive home the conversation around all types of different programs to understand what direction they would like to go. By listening to their goals and objectives is where then we can make those twists and turns on driving different strategies based around those goals that they have. It's really important, once again, that we talk about the fun side of the program, but then we also drive home the health management side of the program. Our team is also here to help with driving the conversation around incentives and communication. In order to have engagement in your program, those 2 strategies are so important, and we're here to talk through the client on different ways that they can address the incentives and address the communication. Communication can be done in all sorts of ways: emails, text messages, posters created, postcards sent home in the mail, and then we can help design and talk about what all of that verbiage looks like with the client. With the incentive structure, there are different types of incentives. There's compliant versus non-compliant rates for lower medical premiums. There's HSA contributions, gift cards, or raffles and drawings, or even cash incentives that some employers do. So we can tie all of that together in different conversations with the client. But our population health team is here to help you guys as account managers, benefit specialists, consultants, data analytics team, to be able to work with the client and take that piece off of your plate. Think of us as an extension of your guys' team. We are here as an added value to the client to make sure that they feel supported from McGowan Brabender. So on behalf of the Population Health Team, thanks for joining and learning about us today, and look forward to diving deeper with you guys. Thanks.